Good afternoon, everyone. Thank you so much for taking the time out of your day to join us for our HealthLinks webinar. My name is Michelle Hahn, and I am the Community Programs and Events Manager for HealthLinks. And I get the pleasure of working with our team and our community partners to put together these exciting presentations for you all to help provide you with resources that can build a healthy culture in your workplace. I'm really looking forward to our presentation today about building a healthy food culture, and I'm excited to be joined by two wonderful people, Matt and Katie, who I'll introduce in just a second. But before I introduce them, I just wanted to go over a few housekeeping items for everyone. So just so you know, we're going to be keeping everybody on mute so that we don't have any interference or problems with sound. So if you have a question, simply use the chat box or the question and answer box that you should see in your little control panel up at the top of the screen or to the right side of your screen, depending on the computer that you're using. We'll also save just a couple of minutes at the end of the webinar today to do some additional questions if you have any, and then we'll make sure that you have access to the presenter's information to send them a follow-up email if you need to. We will also be recording this webinar, so if you would like to listen to it again or share it with your colleagues or friends, you may do so. I'll make sure that we send out the link to the recording after the webinar. And in that email, you'll have information on what's being presented today, some toolkits and additional resources. And then there will also be a really quick feedback survey that we ask you to just take the time to complete quickly so that we can continue to provide you with webinars that are valuable and useful for your workplace. Today, we are going to have two presenters. The first half will have Matt Jackson from Tri-County Health Department. He's a healthy food and beverage policy specialist, and his current work includes implementing healthy meeting and healthier vending policies. And previously, he focused on healthy eating, active living, and tobacco policies, along with environmental changes at work sites in order to improve the health of all employees. He'll be presenting for the first half and jump off, and then we'll be joined by Katie O'Connor, who is the Healthy Hospital Coordinator at Children's Hospital Colorado. And in her current role, she administers the Healthy Hospitals program, which focuses efforts on developing an environment and culture that positively supports the whole health of patients, families, visitors, and team members. And she also does a lot of strategic direction for their employee wellness program. So I do not want to take any more of their time today, so I'm going to hand things off to Matt. Matt, the floor is yours.
Thanks, Michelle. So as Michelle said, my name is Matt Jackson. I'm the Healthy Food and Beverage Policy Specialist here at Tri-County Health Department. We are the health department for Adams, Arapahoe, and Douglas County in the Denver metro area. I'm also part of the Healthy Beverage Partnership. We're a collaborative made up of the 6 local public health agencies in the Denver metro area. And we are working to prevent obesity and chronic disease through education, environmental, and policy changes. And that does include in work sites. So I'm going to share a little bit about what we've been doing, a little bit of background, and then give an example of some of the work that we've been doing here in the metro area. So I wanted to start off with why are we talking about food at work? I know we have a variety of sizes of workplace sizes of people that are attending today. So some may have vending machines, they may have cafeterias or concession stands, and some may just have a few employees, and maybe it's what you're bringing into work or what your employer is providing to staff throughout the day. So I thought this was an interesting stat. So in an 8-hour workday, a person generally has around 113 food decisions to make. That could be anything from what they're going to eat for breakfast, lunch, or dinner, the snacks that they're having, the beverages they're having. That could be walking by somebody's candy dish that sits next to them every day. And so this is one of the reasons we really wanted to touch today on kind of the food environment in workplaces and what are some strategies that we can start working on today that will make incremental changes in our workplaces as we move forward. So Michelle asked me to start a little bit with just kind of background on why is it that we're focusing so much on kind of environmental changes and policy work. And I wanted to go through a few of these bullets just to kind of give you an idea of why this is so important from a policy realm at your workplace. The first thing it does is it really, when you pass a policy, it's clear expectations for both staff and for, I guess, administrative level on what it is that you're doing and why you're doing it. It provides consistency across your agency as a whole so that everyone is aware of what the rules and policies are. It holds the agency accountable to the direction that you're going from a worksite wellness perspective. We don't generally like to talk about whether things are enforceable or not, but when you do have a policy, there at least is a something for the agency to fall back on if you are having issues. And then lastly, we know that there's inevitably going to be some sort of turnover at most workplaces, whether that be the workplace champion that's been pushing through some of these great policies or at the executive level. And so we want to make sure when we pass policies, one of the main reasons is so that it's sustainable over a long period of time. So even if you do have some turnover within your workplace, that the policy stays and is continued to be followed after that. So when I talk about policies and worksite wellness, most people are kind of like, I don't know what that means, or they aren't quite aware of what some of the options may be when we're talking about worksite wellness policies. I know that HealthLinks has done a great job of promoting a lot of large variety of policies that you may or may not be working on. So I just wanted to give a couple of quick examples. So obviously there's tobacco policies. We know that people are not allowed to smoke in their workplace, but do you have smoking on the grounds of your worksite? And other policies that may go along with that, including cessation policies. One that we've been working on quite a bit here at Tri-County is breastfeeding policies, and are you allowing time and space for workers to lactate for those moms that are coming back to work? And then two that we're going to touch on today, one is healthier vending. So if you do have vending machines in your worksite, what are some changes that you may be able to do to increase the healthy options? And then lastly is healthy meeting policy. So if your worksite is hosting meetings, whether that be internally and or externally, and providing food, what is it that you're serving your employees? And what is the culture that you're building with the policies that you may or may not already have in place? So before I get into this slide, just some of the work that we've been doing through the Healthy Beverage Partnership here in the metro area. We've been doing vending machine assessments with a lot of the organizations that we're working with. And so what we do in that process is we go out and assess every product that's in the vending machine, so both beverages and food or snack machines. Through that assessment, we've got quite a bit of data that I wanted to share. So we've seen in the beverage machines that we've assessed, the average percentage of healthy items in the machines is 28%. So that means that 72% of the items are unhealthy. And on the snack side, it's actually less healthy. We've seen 16% of the snacks in the vending machines in the metro area that we've assessed are deemed healthy, with 84% unhealthy. So I think that gives a good snapshot of why it is we're doing some of the work that we are doing. I think there's a lot of opportunity out there for organizations to look at what they're providing. Even those organizations that may have an outward-facing facility, so they may have the public coming in or clients. Most people aren't coming to your facility to purchase things out of your vending machine. Most of the people that are using the vending machines at the facilities that we've worked with are the employees. And so that's one of the reasons we've really been focusing on some of the employee wellness side of vending. Just a couple of kind of things that you can do outside of the realm of strictly changing your vending policy is looking at what kind of labeling and signage do you have on your vending machines or around your vending machines. So you can see in the photo here, it says "Hello Goodness." It's kind of promoting more of a healthy, I guess a healthier vibe than having a machine wrapped in a soda can or some sort of unhealthy snacks. You also can see that it's somewhat inviting with the open glass case, and these specific Hello Goodness machines are providing healthy beverages to this specific employer. Obviously, the main thing we look at when we're looking at vending is what are the products that are in the machines. So like I said, our assessments have shown that a vast majority of the machines are unhealthy. And so what can you do working with your vendor directly to see what other products are available? So I will have a link later in the presentation of some resources we have, but we do have a list of products that are available, as well as a list of potential other vendors if you're having an issue with your current vendor that we are happy to share, so that you can take that to your vendor directly and let them know maybe some changes that you'd like to see. I will say we've worked with a number of vendors, at least in the metro area, and with kind of a variety of results. Some are much more willing to work with our organizations and make changes, and then there's some that are have been a little less willing. So one other strategy you can look at is pricing. So when we're looking at pricing, it's not only what is the price of each item, but how are the healthy items priced compared to the unhealthy items. Ideally, we'd like to see the healthy items priced at or below the price of the unhealthy items. Sometimes this is referred to as subsidizing the cost of the healthy items with the unhealthy items. But we've seen that this is an evidence-based strategy that works to help direct the behavior of the employees and what they're purchasing. And then obviously, like I've talked about, we are working on vending policies as well. And I will share the link to a policy toolkit that we've developed through the Healthy Beverage Partnership that has model language and other resources available around vending and healthy meeting policies. So that'll be towards the end. So I talked about a little bit about some of the strategies. Obviously, policies is where we're really focusing on, but there are environmental changes that you can make within your organization. I talked about what the wrap of the machines look like. Here's a quick example of one that organization we've worked with. You can see on the left, it's promoting a soda, and on the right, it's promoting Aquafina. You can also see that the choices have changed within the machine. There's more water and diet soda options compared to sugar sweetened beverages on the left. So this is one kind of simple change that you could approach your vendor, possibly approach your vendor to see what the options may be to switch out what the machine itself is promoting. I'm going to get into the healthy meetings. And so one of the examples I always like to share is these are photos that we've taken out and about in the work that we've done. So rather than promoting sugary beverages, you can see the photo on the left has what is referred to as either spa water or infused water. We do get the feedback occasionally from employees that the tap water in their facility may not be up to what they would like. And so this is another option you can do to promote water rather than sugary beverages. These are also great for meetings. So rather than purchasing juice or some other beverages that you can provide with a lunch, this is a really inexpensive way to provide something else to employees. You can also see on the right, this was a salad bar that we had here at Tri-County. It has a variety of items, and so rather than people bringing in for a potluck unhealthy items, we specifically had a salad bar that promoted more healthy choices. So when you're looking at these individual policies, and I should point out, our healthy meeting policies also do address physical activity and what I would call environmental factors. So things like sustainability, what type of products are you using, and where are you holding the meetings. So that's all available in our policy toolkit as well. I'm going to get into a few of the kind of lessons learned that we've had in some of the work that we've done. The first thing is communication. So the communication that you have with your employees around any of these policies or changes that you're making is really important. Some of the things to think about is, who is the policy going to impact? What are the specifics of the policy? Where will this policy take place? Is everyone impacted or just some of the employees? How long of a time frame are you giving yourself? So when is the policy going to be implemented versus when are you going to notify employees? We found that the more time that you give yourself to communicate with the staff, the more likely that the policy is going to be successful. I think the other big question to ask is why are you moving forward with this policy? So even here at Tri-County Health Department, we initially got some pushback when we passed a healthy meeting policy because we had employees saying, "Are you going to take away the donuts? Why are we doing this? We're a health department." And I think having time to explain why you're doing a policy is really important. And so in our work here, it wasn't that we were taking anything away from our meetings. It was more that we were adding a healthy option. So on the next slide, I'll get into the framing of how you are approaching your employees about this. So like I said, with our work, it's generally the more positivity you can bring to the framing of how you're kind of selling the policy, the more likely it is that it'll be successful. I talked about kind of the why you're doing it. I think being as transparent as possible is the best approach to take when you're going through with these policies. We spent a lot of time with the organizations we've worked with doing education around why policies are important and why these specific policies are important. It also helps with the culture of your workplace when they know the reasons behind some of the policy changes that you're trying to adopt. The last thing that the way that you're framing this has really helped is buy-in from the rest of the staff. So I'm not going to say that all of our policies that have passed have had 100% buy-in from all staff, but the fact that we've taken the time to educate and inform them about the changes has drastically increased the buy-in percentage, I would say, with the employees and employers that we've worked with. Just a couple things to consider when you're looking at some of these policies and what you can do within your agency right away. So what is your organization's view on healthier food and beverage options? So what's the current environment already like? We've had some organizations where they've already been doing 85 to 90% of what the policy says on their own without a policy. And so those are generally a lot easier to pass. And we've also had some organizations where it's been a little bit more of a struggle and it's taken a lot more time, like I said, to educate and inform not only the staff, but also the executive level leadership and get their buy-in on why this is important within your agency. I know Katie's going to talk a little bit about the culture that they've kind of set for themselves at Children's, and I think that's just a great approach that they've taken to get kind of a wide variety of buy-in from all levels of management. The second question is, who should be involved in the process? So obviously this is going to be dependent on each organization, whether you have a wellness team, you have a buy-in already from leadership, but it's really important to kind of strategically think who needs to be involved in this. Do we need to bring HR in if they're not currently involved in some of these pieces? Do we need to have a key member of leadership that's going to push this through? Are we going to use a bottom-up approach where we're going to have enough buy-in from the rest of the staff that leadership is going to jump on board? So I think those are some of the things that you can discuss. So number 3, again, how can you gain support within your agency? I think the more kind of champions within your agency that you can develop, the more likely it is that any of these policies will be successful. We want to have as many people speaking to the positive effects of these changes rather than constantly hearing about the negatives. And then lastly, I think something that's really important to consider is what or who are going to be the barriers to making any of these policy changes. We all know that there may be that one person in our organization that isn't going to jump on board. And it's just how do we work either with them or get them to at least understand the reasonings behind these changes and strategically thinking again, how are you going to work that within your own organization? So I'm going to give one quick example. I know Katie's going to talk a little bit more about what's going on at Children's and some of the great work that they're doing. One of the examples that I'm going to share is we've worked with the City of Westminster. They were really interested in looking at what are they serving within their organization, primarily in their vending machines. And so this included all of their 12 locations that they have across the city. They had 43 vending machines when we did the assessment. So I went out with my colleague from Jefferson County and assessed all of those machines. And we came back and they had a great setup. They had buy-in from both their employee wellness coordinator, who was kind of working on the HR perspective, the recreation facilities superintendent, and the recreation manager. One of their major concerns was how is the public going to perceive these changes? And then having the employee wellness coordinator on board to deal with some of the employee worksite wellness issues was a great strategy on their part, so that they were hitting both sides of this, looking at who's using their facilities. So these facilities spanned everything from public works and the city hall to all the rec centers. So again, this did have a kind of a public component to it as well. They started off with what I think they would even say were some dismal percentages when you're talking about healthy beverages and snacks. And they said, our end goal is going to be 100% healthy beverages, 100% healthy snacks. And so they took the approach of, if that's where we want to get, let's just start with that. And so they did a lot of education around why they were making these changes. They did taste testing with new products that were going in the vending machines to make sure that the employees knew, okay, if I'm going to spend $1.50 on this new granola bar that's healthy, what is it going to taste like? They had a lot of feedback from employees that the reason they were buying things in the vending machines is because they knew what they were getting. So there was an education about not only why were they making the changes, but what the changes actually were. They did the same with the public. They did a large educational campaign. They had posters up around the vending areas. They did do some taste testing so that they got some feedback from the public on what it is they wanted. And so they really took what I would say a long-term approach on how are we going to get there and what are we going to do. This next slide goes through the timeline, and I don't think that this is necessary for every organization. Again, it depends on where you're starting at and where you're hoping to get to. But they started in March of 2016. We started with the assessments, and you can see that this process ended up being over a year long. And it's still actually ongoing. We've done some reassessments with them, and they're still making some tweaks and changes to some of the products on their vending machines. But you can see they did a baseline report that they presented to their leadership within their organization, as well as to their employee wellness coalition. They ended up choosing a new vending company, and so that did draw the process out a little bit. But they developed a new RFP, which is request for proposal for vending companies, to see who would want to come in and work around the parameters that they were setting. And we do have language for those of you that may be interested in finding a new vendor if you have to go through the RFP process. They selected their new vendor. Their vendor that they're working with now has been great to work with for them. They've been really receptive when products either aren't selling, or if there's products that occasionally do slip in that are not meeting the guidelines that they've set forth for what is determined to be healthy. And again, we did reassessments, and their vending beverages were up to 90% healthy starting from around 20%. So it was a pretty drastic change within about a year. I've talked a bit about some of the resources that we have available. We do have a healthy model policy templates. And so these are model policy language that you could take and shape into what's going to work for your organization. We have healthier vending, healthier concessions, and healthy meeting policies. We also have examples of policies that have been implemented by organizations in the Denver metro area. The other thing that I'm happy to share is we have policy implementation support materials. And so those are things like frequently asked question sheets that we've used to help educate staff, fact sheets, and other kind of supporting materials. We have a healthy meeting checklist that's been really helpful here within our agency, so that those people that are hosting meetings can just go straight down the checklist and make sure that they're aligning with what our healthy meeting policy states. So there's two separate links at the bottom of this slide. One is the one that is Tri-County, so that is that will have all of those policy templates, the toolkit. It also has a toolkit for a Hidden Sugar is a educational messaging campaign that we have running currently in the metro area. That's really been helpful in some organizations to kind of explain why it is they're making some of the changes that they're making. So feel free to take a look at that. And lastly, I didn't touch base on this. I think one of the important things to really go through in this process is trying to determine what are you deeming healthy and what are you deeming unhealthy. And so we have, through our Healthy Beverage Partnership, some guidelines that we're utilizing in the metro area. But I also wanted to share kind of nationally some of the things that are being discussed. So this bottom link is for the Federal Food Service Guidelines. And those Those guidelines are based off of the 2015 to 2020 dietary guidelines for Americans that was put out by the CDC. And so those also do have guidelines that you could utilize to help determine what you want to deem healthy versus unhealthy. And if you have questions on that, I'm happy to connect with you after the presentation. I think my time, oh, I'm sorry, I had one more slide. So something that we have going on here at Tri-County through a grant that we have is we have convenings for work sites that are in our jurisdiction and in the Denver metro area. Some of the benefits obviously are kind of the networking and mentoring of things that are happening in work sites across the metro. There's other resources and trainings that become available through that process, assistance with the HealthLinks certification, and there are also some funding opportunities as well. So my colleague here at Tri-County, Michelle Haw, I have her contact information with her email and phone number at the bottom. If that's something you're interested in, you can reach out to either her or myself for more information. Lastly, this is my information. Feel free to call or email. I'm happy to help out however I can. You can see the image here is one of our educational campaign material pieces that we have. That's comparing the amount of sugar in beverages to the amount of sugar in cookies that you may eat. Again, this has been fairly successful campaign that we've been using in organizations here in the Denver metro. So I think I am out of time. Again, I have to jump off the webinar, but please contact me if you have any further questions. Check out the links if you'd like to look at those toolkits that we have available, and I appreciate all of your time.
Great, thanks so much, Matt. And just to remind everybody, we will share a PDF of the slides that you have access to those links, and then the toolkits and other resources that Matt just presented will also be in that follow-up email. So you can take a look through those and then have his contact information as well if you want to reach out to him. But we're going to let him go, and if you have other questions that come up from this, either myself or Katie, I'm sure can answer them, and if not, we'll get back in touch with Matt and answer those questions for you. So Matt, have a wonderful afternoon. Thanks again for taking the time to join us.
Thank you.
All right, and Katie is on the line as well. Katie, are you there?
I am. Hi.
Hi. We're going to pass things over to Katie now for the second half to kind of share a success story of what this looks like actually being implemented at an organizational level. So Katie's just going to share her story from Children's Hospital.
Great, thank you. And thanks to Matt for laying a good foundation for me to work off of. Just to give an overview of Children's Hospital, we're Children's Hospital Colorado. I should have said that, our whole name. But our mission is to improve the health of children through coordinated programs of patient care, education, research, and advocacy. We have over 10,000 team members. That's employees, faculty, contract employees. And then we have about 6,800 employees over about 16 locations. Our employee wellness team is a team of 2. And I have to say we do a pretty good job being a team of 2. My background is in public health, as is our wellness coordinator. And she is our wellness coordinator and focuses solely on our employee wellness program. My position is the health promotion programs manager. So I oversee a program called Healthy Hospital, which is really focused on all of the impacts of health. So nutrition, physical activity, mental health, emotional and spiritual health, and then sustainability and employee wellness. So mine is a bigger focus on the environment of the hospital, making sure that we are modeling the behaviors that we want to see in the community and that we're advocating for in the clinic. And then I help drive the strategic direction of our employee wellness program. So I said a little bit about Healthy Hospital, but really my position, I work with partners from all over the hospital, and then internal partners and external community partners, focused on interventions and policies that address interrelated conditions such as social, emotional, or social, environmental, and economic. We did start the at-home approach. So an example with our sugar sweetened beverage initiative, which I'll get into, we wanted to make sure that we were modeling what we were teaching kids in clinics and what we were advocating for in the community. So we can't really do that fully if we're not doing that at home. And so we tried to move forward with all of our initiatives now, making sure that we're doing these things at home. And a little bit of engagement and buy-in. So my role with Healthy Hospital, it was very much a grassroots effort to change the environment of the hospital. And it really stemmed from the obesity epidemic, specifically pediatric obesity. And so initially it was a big group that got together internally and said, we need to do some work on our internal environment. Again, a multidisciplinary team, which is helpful in moving any type of initiatives and policies forward, I think, and specifically in our organization, getting buy-in. When we have some of the clinical folks on board, some of what we're advocating for seems to have more legitimacy. So our groups, specifically our nutrition group, in about 2011 or 12, we really started to look at our nutrition environment. And we did an initial assessment. We were in a cohort group with 25 other children's hospitals looking at our nutrition environments. And from that came, we all decided that we need to do something about the nutrition environments because they were not supporting health. So we started working through our vending. We started first with our vending. That was back in 2012. At the time we had some RDs on board. We had the director of food service. We had executive chef. We had clinical nutrition, employee wellness. So we had a really strong group of people. And it's always important, I think, moving any type of initiatives forward within an organization to identify executive champions, and not just any executive champions, but you really want to try to feel out and figure out which ones are the best ones to champion. Right now, my executive champions for the work that I do is our Vice President of Population Health and Advocacy, who does a lot of our community work. And then our Vice President of Support Services, which is our facilities and our food services and our grounds. And so having those champions on board helps me move things through the system a little quicker. Another big piece of engagement, which I don't know that is talked about as often, is advocacy. I very much see myself as an advocate within my organization. There are certain initiatives or programs that I might be pushing that may not be popular with some of our leadership. Maybe they're going to cost some money. Maybe they're going to be a potential faculty to satisfy, or like removing sugar sweetened beverages. And so sometimes all the time, I should say, I really see myself as an advocate. So I'm really pushing for the things that are within my job scope and the things that I believe are best for our organization. And that sometimes, you have to keep pushing what is best and what is healthy, and what is going to support your population. And so by informing our executives on things maybe they don't have as much background in, comparing to other organizations. I call around to national other hospitals, children's hospitals across the country to find out who's doing what, when they started doing it, how are they doing it, do they have policies that they can share with me? Because as a top pediatric hospital, we like to compare ourselves to other hospitals out there. So that's helpful for me to get buy-in. Making the business case, which when in grad school, I have a master's in public health. I did not learn that. And so when I came into this position, like, we need to do this because it's the best thing for our kids. But really something that I learned is that I have to make the business case for something. What's the ROI? What's the VOI, value on investment? What are the health impacts? And previously I was just focused on the health impacts, but I always have to make a strong business case, and I have to figure out how to do that. Aligning with our organization mission and strategies. We have a couple of our top strategies here. One, we have a population health strategy. So it's easy for me to leverage some of the things, leverage that when I want to implement certain things within our environment. We also have a target zero is one of our strategies, which is to to eliminate preventable harm. And so when we were removing sugar sweetened beverages, I said, hey, you know, sugar sweetened beverages, we know the harmful impacts these are having on kids. We know that sugar from sugar sweetened beverages that's the #1 source of sugar in kids' diets. So, you know, technically this does not align with our Target Zero initiative because we know the harm that it's having on kids, yet we're still selling them. And it was hard for our executives to ignore that once that was aligned with that strategy. So I think that's always important. And then responsibility, like as a hospital, we have a responsibility. We're an anchor institute in our community. Parents look to us for information, for health information. And we have, you know, we influence behavior. So we really have a moral responsibility to be doing the things that we're advocating out in the community or in clinics. And then accountability. So we joined the Colorado Healthy Hospital Compact in 2014. And we also, we are part of Practice Green Health, which is a national organization focused on sustainability in healthcare. They partner with Healthcare Without Harm. And then there's some other ones out there, Partnership for Healthy America. I think it's easier sometimes to move initiatives forward within an organization if you're part of some type of national, local, or state efforts. For me, that's been my experience. So I think it's important to have that accountability. So I put this in here because what does healthy mean? I think it means different things to different people, and I've learned that from meeting with other stakeholders in the community. It depends on what your focus is. And so initially, when we were revamping the food environment here at the hospital, we were focused on obesity. So we are focused on low calorie, low saturated fat, low sugar, low sodium. That's not nutritious to everyone. You can have a package of fat-free Doritos, and that might meet the healthy criteria. And when I say healthy criteria, we use the standards that are in the Colorado Healthy Hospital Compact. And so to all people, that's not healthy. But you have to meet people where they're at. So if our vending machines, which we call micro markets, they're self-serve micro markets, if we had all seaweed and kombucha and cashews and stuff in our markets, we're probably not going to sell a lot of stuff. So you really have to get people engaged where they're at. And a lot of people might try reduced fat Doritos before they're going to try a package of seaweed. So we meet the criteria. We label here of the Colorado Healthy Hospital Compact. We label with stoplight colors. So we have green, yellow, and red. So if it meets the criteria for a snack is 200 calories. If it meets the criteria, it would get a green dot. So we label everything through our vending and cafeteria with green dots. And then we worked with our RDs and our clinical nutrition department to determine what is a yellow product. And this is a really elementary way to label. It's not exact science. It's not perfect. You know, string cheese and hard-boiled eggs, those are healthy foods that we want to encourage people to eat, but they're a yellow food because they're higher in one or more of those areas. So if they're higher in one, if they miss one from the green standards, then they're yellow. If they miss 2, they're yellow. If they miss 3, they're red. So if something is too high in calories and sugar, it's a yellow. If it's too high in calories, sugar, and saturated fat, it's a red. We also label our beverages. We did go sugar sweetened beverage free in March of 2017. We label all of our unsweetened beverages green. We label our artificially sweetened beverages yellow, and then we really don't have any more red beverages anymore. So, so you see some other ways that people kind of use the word healthy. I worked with DU for a little bit, and they're really focused on environmental sustainability. So making sure that that the social, political, and economic factors related to their food system and the products that they're purchasing, they're really focused on that. Fair trade, humanely raised. As a pediatric hospital, and for our Employees, we're really, we know looking at our claims data that 57% of our employees have an elevated BMI and 76% are not eating enough fruits and vegetables. So we're really focused on lower calorie, saturated fat, sodium, sugar type items. We're focused on increasing access to healthy fruits and vegetables. We are bringing in more plant-based items. So we have a lot more packaged items that are like quinoa cups or bean cups that are all plant-based. We have a new vegan burger on our menu that we're rolling out with next week that is similar to the Beyond Burger that's sold at Whole Foods, and it really tastes like a burger. And I think people shy away from that, but we're going to do some samplings in our cafeteria next week. We're going to have our chef there having samplings of the burger, and then we're going to have our dietitians there talking about where meat should be on your plate. And then I'm going to be there talking about the environmental impacts of heavy meat diets. We can go to the next slide. So some of our initiatives that we've done here at Children's, we started again in 2012 and 13, going through all of our vending. At the time, we had Canteen, and I know a lot of people have Canteen, and we really struggled, similar stories that I've heard from other organizations. I just want to remind people that, as hard as it seems, the vendor works for you. They have a contract, they work for you. So it's difficult to have those conversations, but if they're not doing and they're not meeting you where they need to be, you go with a different vendor, and that may be easier said than done, but that's what we did. We tried to work with Canteen, it didn't work, and so we went with another vendor. And then we started in our vending by revamping our vending. We then moved into the cafeteria, labeled everything. In 2014, we really focused on stairwells. We put a lot of new signage in the hospital because people couldn't find stairwells. They were kind of hidden. And then we started having students come in from the Denver School for the Arts and paint beautiful murals in the stairwells to really encourage people to take the stairs. In 2014, we also became part of the Colorado Healthy Hospital Compact. And to us, that was so helpful to have that accountability, to know, our executives knew that, this was something that we had signed on to CDPHE, and, we had some standards that we were going after. And so that really, really brought us to the next level. We're now a platinum, at the platinum level, which is the highest level, and getting rid of sugar sweetened beverages helped us get us there. And with that, we really increased the amount of healthier foods we have and beverages we have here at the hospital. And then we really, they have a whole marketing section. So, removing all of the unhealthy items from around registers. So around all of our registers is, of course, water, but only healthy snacks. And then not promoting any type of unhealthy beverages, or we have water on all of our vending machines. And we've also increased breastfeeding support and resources, which is part of our Colorado Healthy Hospital Compact. We've had 2 policies that we've put into place. In 2016, we put in a trans fat policy. We were already practicing that, but to solidify that with a policy, we had a food service director who was very supportive, but if he had left, who knows what would have happened. So the moment that I could get him to sign a policy, that was good. It was kind of a done deal at that point. In 2016, we also put electronic menu boards through our cafeteria, which allowed us to add all the nutritional information for the daily specials that we were offering. In 2017, we rolled out with our healthier beverage policy. That was our elimination of sugar sweetened beverages. And as you can see, we were very careful in how we worded that, but it was the Healthier Beverage Initiative. We got a lot of pushback on the artificial sweeteners. That was one of the top themes. And so we didn't say healthy beverage, we said healthier beverage. As a children's hospital, we do not promote beverages with artificial sweeteners. We only promote unsweetened beverages and mostly water, but we do offer them here. So we still get a lot of pushback on the artificial sweetened beverages. We also last year bought a bunch of walking workstations, which are basically treadmills with a workstation, so people, and then we put them throughout the hospital so people can take their laptop and go over there and and do a webinar or a meeting or whatever they need to do and get some physical activity. We, in 2017, also rolled out with some wellness walks with our leadership. So we had them all throughout the summer, and we basically put it on our leaders' calendars, and they would show up and they would basically lead a walk around our campus for 20 minutes. And it was really fun. And our leaders liked it because they go from meeting to meeting and they got to get outside and engage with people. And so I think we'll do that again this year. And it was a really fun way to engage them and also let people know that it's okay to go out and get physical activity during the day, because I think that perception lives here in our culture that I can't go do that. But incorporating our leaders into that activity was really helpful. And then this year, we are doing a produce, we've contracted with a company, we are going to do a produce delivery service here to the hospital, and our employees get a pretty good discount on organically grown local produce. And so we are going to start that in a couple of weeks, and they'll do weekly deliveries, and then if it's really popular, we might do multiple days during the week, sorry. And then we have a gym rebate program. So everybody, regardless of whether you're on our benefits or you're in our wellness program, all employees get a $100 gym rebate this year to really try to encourage people to get physical activity. So some of our next steps, some of the things that we're looking at this year is we are rolling out with a produce garden, a really large produce garden. We're very excited about that. We really, again, focusing on nutrition, we really want to be teaching people, and specifically kids, where food comes from and what types of food we should be eating. And we feel as though if kids pick tomatoes from a garden, they'll eat tomatoes. If they pick kale out of a garden, they grow kale in a garden, they'll eat kale. And so really trying to increase access to fresh fruits and vegetables. We're going to do some farm stands here as well. And then we're also going to support some food insecurity programming within our community and within our employee population. So Matt has some great slides with the healthy meeting policies, and I've looked at healthy meeting policies from Denver Public Health and Denver Health. We're just not there culturally. We've made a lot of other strides, but we are not there. So what we're doing is we are currently drafting a healthy meeting and event guideline. So we go through the process kind of, and it's basically put into a guideline. It's signed by an executive and it's put out there for everyone to see, but it doesn't say you have to do it. It's just giving recommendations and guidance. And so hopefully in a couple years, we'll be at a better place that we can institute a policy. Again, we're increasing the sale of locally sourced products. We're going to have some farm stands on campus this year, which we're excited about. The farmers market, the boxes that are going to be available to our staff. We're really focusing on less meat, better meat. Again, we are a member of Practice Green Health and Healthcare Without Harm, and we are trying to not only educate about the physical impact of eating a heavy meat diet, but also the impact on the environment. So we're going to be doing a lot more education. We are moving towards phasing out antibiotic meats and bringing in more plant-based options. We are going to do discounts on our daily specials that are healthy or green, that are labeled with the green icon. And again, I mentioned we're doing some food insecurity initiatives here, such as fruit and veggie prescription programs. And then we are going to be a sponsored and site for the Summer Food Service Program, which is with the USDA. And so for all the kids that get free or reduced lunch during the year and are out of school for the summer, we want to make sure kids have access to lunch. And so we are going to be implementing that program here. And then hopefully down the line is the removal of fryers. I want to see those go. We have a new building going up in North Colorado, somewhere in Thornton area, Northern Colorado. We are advocating really hard to not put the fryers in there so we don't have to pull them out. So I think that's going to be happening. And then once we do we have to totally reconfigure our cafeteria here. But when we do that, I have a presentation ready to give to our executives about, reimagining hospital food. And so hopefully we will be removing our fryers. So some lessons learned. Number one, my preceptor told me this years ago when I was a graduate student, and it was difficult for me, but it was like start with baby steps. Initially, one of the only air quotations when I say healthy, we had not a Snickers, we had a Hershey's bar with almonds in our vending machine, and we gave that a yellow label at the time because it had almonds in it. Like, that's how bad our vending machines were. And she would always tell me baby steps, so baby steps, you know, they're not always satisfying, but they do really add up. And when you can really start stringing some of these things together, it's easier to push those larger initiatives forward. Again, look to other similar organizations, reach out, find out what other people are doing, and, you know, provide that information to leadership, because sometimes that really works, and it's worked for me. Ask what employees and customers want. We do a lot of surveying here, and we can't send surveys out like through the large organizations. So we have certain surveys they want our employees to do, and they don't want people to get survey fatigue. And so we have to go with iPads into the cafeteria, and we have to do wellness fairs and give people prizes to do our surveys. But we ask people what they want. How will you feel if we do this? And because we want that information. And that's always important to have. Again, we do a lot of samplings and tastings in our cafeteria. When we did our Healthy Beverage initiative, we did a 2-week rollout of that. And we had tastings, and we had our executives there at the tastings for 2 weeks in the cafeteria. Communicate. Most of the time, I say it's really good to communicate, like those sugar sweetened beverages, those big initiatives where you want to answer questions. But when you have other things, we've been doing a Meatless Monday down at our South Campus location, and we didn't tell anybody, and it's been selling out every Monday. Because sometimes when you tell people, you'll have some noise that maybe wouldn't be there if you just did it. Engage leadership, and even more importantly, informal leaders who have a lot of influence. Wellness champs have been a lifesaver here at the hospital. We have great group of wellness champs, and they really spread the message through the organization. And then get some interns. I use a lot of interns from the Colorado School of Public Health, and they do phenomenal projects for us, and they have really helped push our wellness program forward. This is my contact information. If anyone has any questions, I didn't provide any of our resources, but I'm happy to share any of our marketing materials, any of our policies with people if they would like.
Great, thanks so much, Katie. We do have a couple of questions that came in as you were talking. So first, will you remind everybody who your current vendor is for your vending machines?
It's PGI.
Great. And then who are you using for the produce delivery?
So we're doing Colorado Fresh Produce.
Great. And it looks like, Elizabeth, you asked that question. I'll get that information from Katie and put it in the slides or in the follow-up email as well, so that if you are interested in reaching out to them and seeing if produce can be delivered to your workplace, it'll be in there as well. And we also have if you go to our resource center and do some searching, you could find some places there as well. So if you go to healthlinkcertified.org and just click on the resource center, we have some options like Fruit Revival and other things listed for delivery to your workplace. And then another question for you, Katie, can you talk a little bit more about the business case and maybe some things that you learned to get leaders on board and what that looks like?
So coming from a public health background, the business case was really hard for me. You know, I came in, I was like, what do you mean you don't want to, what do you mean? Like, we have to, get rid of our fryers. We have to do X, Y, Z because it's healthier for our patients. Why wouldn't we do that? Well, if it's going to cost a lot of money, you really got to figure out that business case. And so when I say business case, you got to come up with, you got to quantify, like, what's going to be the revenue impact of doing something? And then is there ways to offset that? And, is what you're advocating for align with your mission? And of course, all of that could be in a business case. The financial piece was really new for me. I've since got a lot better at making the business case. But again, some of that is looping, you always want those financials. Like, executives are going to want to know, okay, if we remove sugar sweetened beverages, what's that going to look like? What kind of impact is that going to have on our revenue? I'll give you one example. We have these little Flavia machines. They're basically like coffee machines in all of our break rooms, all of our patient areas, all across the hospital. And we just pay for that. That's an operational cost. It's very expensive. But when we removed sugar sweetened beverages, we had a hot cocoa pack that was in there. And of course we were removing that, but that one hot cocoa pack cost us $50,000 a year. So when we did that, in my mind, I had that in my back pocket, because every time somebody would be like, we're down whatever, I was like, oh, we're still saving $50,000 a year in that hot cocoa packet. So I don't know, like I try to be clever about it, but some of these things, some of these changes do cost more money, but then you can look at the potential health impacts. If you look at your claims data, if you work with your benefits team to look at like what's going on with our population and how can this initiative potentially have some impact on the health of our employees.
Thank you. And just to add to that, I think the business case for health and safety changes in the workplace is always hard to make, because like Katie said, it's hard to show that you're actually saving money, and sometimes it does cost more money. But if you think about it and communicate the value of investment instead, and think about your morale and the culture in general and the retention in the workplace, people feel supported and are supported well in an organization, they want to stay. And so you have those costs, you save costs from turnover and training and all of that stuff, and people are in the office more. If they're healthier, they're probably not taking as many sick days. So you can't necessarily add a number to all of those, but if you can make the value case instead, sometimes that goes a long way, and even is a better case to make than the business case and the financial side, especially for the smaller organizations, because it does cost more money than a larger organization in some aspects. We have a few more minutes if there are other questions that people would like to ask while we have Katie on the line. If not, I'll just make a couple more points that pulling from Katie's presentation. I know that all of you are not a 10,000 employee organization or have multiple sites, and you may be working with 5 people in your workplace. And just to let you know, you're not alone, and these resources and examples can support you and benefit you as well. And it's the same lessons learned that Katie made or stated. Everything, you have to start small, and whether that means that you start putting dark chocolate in your candy bowl that's on the desk, or adding a fruit bowl alongside the candy, any small adjustments that you can make. If you're already spending money to bring donuts to the office, maybe spend half the money on a healthier option as well, and start trading out those unhealthy options. And even with the healthy meetings, not everybody goes paperless right away or turns every single meeting into a walking or standing meeting, but incorporating little bits of exercise at the 5 minutes at the beginning or a break point. Just starting small and really asking your employees what they want can go a really long way to creating an overall culture change, and then establishing these more as policies and just part of your business practice overall. All right, it doesn't look like any other questions are coming in. So if you do think of any, just remember that you'll have the contact information for both Matt and Katie after the webinar, and you can always contact us at HealthLinks for some additional resources as well. And in order to do that, just go to our HealthLinks website and you can join our listserv. All of our contact information is there. It'll be in these slides too. And I just wanted to do a quick highlight of an upcoming deadline. So for those of you that know about the different awards that are associated with our HealthLinks certification, the Governor's Award for Workplace Wellness is presented at the Colorado Culture of Health Conference every single year. This year, it'll be held on May 2nd at the Convention Center. And in order to be eligible for that award, you have to achieve a leader status through our Healthy Business certification. And we take the top 10 scores of that, and the Governor's Council chooses the winner of that award. So if you are a current HealthLinks business and close to needing to recertify, or you're new and have no idea what I'm talking about, follow up with me afterwards. But if you get an application in before the end of this month, you can be in the running for that award. So I just wanted to highlight that for everybody. I don't want to take any more of anyone's time, but I really appreciate everybody jumping on the call with us today. And thank you, Katie, for presenting this great information and sharing your story. We'll send everything up in a follow-up email very soon, and we look forward to seeing you at our next webinar. Have a great day, everyone.